Our next speaker in the health and Oshner, Dr. Jonathan Bidwell. Jonathan is an avid inventor and tinkerer. His 3D printer has been running uninterrupted for the past 5 days. So Jonathan, here you go.
5 days and counting, just changing that printer spool. Thanks for having me. My name is Jonathan Bidwell from Oshner Health, and I have the privilege of working with a number of you, working with Raju, and my colleague Dipesh Gwali is also here in the audience. So my team and I are developing an AI-enabled nasal endoscope. And great. So I'll show you what we're working on. Great. A little bit of background. Many people have sinus infections. Roughly 29 million people per year here in the US. And part of that is just because it's difficult to get access to care for nasal exams. I'll give you a little more background on that. This is a nasal exam on the left. So you've probably been to a primary care general practitioner, and they have this device. It looks sort of like this clicker I have in my hand, but it has a light on it, sort of cone shape. They can look in your ear, say ah. That's called an otoscope, and that's kind of the best general practitioners have for looking in your nose, but it can't see far enough. So the device you see over here is called an endoscope, and there are a couple different kinds, but it reaches further into your nasal passageway. You can actually go all the way back. It's wild and see the back of the throat. That's important because in order to diagnose sinusitis and get the correct antibiotics, appropriate treatment, you really need to be able to look in there. But traditionally, general practitioners haven't had these tools. They've been really expensive for different reasons. And they needed specialized training, essentially, to do that. So although general practitioners could do it, technically they could get billed for it. A lot of times it's just not worth the risk, just not comfortable with this, might make the patient uncomfortable, for example. So our thinking is that we can use AI to help them along the way and to try to diagnose sinusitis, which is head and shoulders the most common outcome, treatable outcome from these nasal exams. You can also detect cancer and polyps and things like that, but they're much less common. So what we've done is we've hooked up a traditional kind of medical workflow here. We've got a camera, nasal endoscope, that's looking down the patient's nose, and that's connected to a monitor, just like a doctor would buy. And this is the same kind of setup for the last 20 years or so. Goes to a portable medical display that you see there in the center. But the difference is we're piping the video out from that display into a little computer, Jetson Nano, which does onboard processing in real time and can give us an overlay back on the screen. Can we flick one of this? So I just want to show you what the inside of someone's nose looks like, because it's kind of wild. Before starting this project, I had never seen this before. A little less gross than I thought coming into it, and easier from a computer vision standpoint. Woo, thankfully. Okay, here we go. So we've got one of our segmentation models identifying different landmarks. This is the middle turbinate. This is a healthy patient. This might be me. And if this patient had sinusitis, to the left or right, you'd see a certain kind of mucus. This one over here is kind of interesting, the second video. You might click me on that. We're segmenting different types of mucus. So believe it or not, these ENT specialists, they're looking for globs, they're looking for crust, they're looking for strands. So surprisingly, this was one of our first findings, it's reasonably straightforward to hand label a bunch of images and actually differentiate different types of mucus. All right, so we do okay with identifying some landmarks. Here are some results here. F1 score over about 80%, which is what we ask our labelers to achieve. So that's just, we need the device to actually be helpful and similar to what a doctor would be able to accomplish. All right, so I talked about sinusitis, and here we go. So let me start this video. Not sure. Okay. started. Great, all right, so this is a healthy patient. Does not have sinusitis, does not have a sinus infection. All right, so what we're doing here is we're identifying a landmark, and then we're looking, since we know what nostril we're in, we're looking to the appropriate side of that landmark and not seeing any mucus. So that's the reasoning behind this. All right, next up we have a patient with sinusitis. And, oh, that's looking, okay, there we go. So you can see there's this white purulent mucus in the kind of the center of the screen right here. This is a different nostril. So this patient does have sinusitis. Yeah, and that's it when it's working. We're getting better at detecting this particular type of mucus. Clear mucus is non-purulent, so purulent would have like the white blood cells in it. Yellow, maybe even green, I've heard. I've never seen green mucus. Apparently it's out there. So there's lots of challenges to this. Right now what you're seeing is a model that every frame it's running a series of segmentation tasks. It doesn't truly know where it is inside the nose, like a GPS, like with a relative coordinate system. So I think after we build that in, this should be pretty feasible to get out there into the public. So we're working with some companies to create a low-cost version of this that ideally could show up in a CVS Minute Care clinic or just in any old doctor's office. Because the price tag should be quite low and the reimbursement is quite high. It's about $800 per exam. At Ochsner, we've got all this data on Ochsner. They do a lot of these. Every year they're increasing the number of these exams that are given and increasing the cost. So look forward to that. About $800, whereas an actual GP visit could be around $300. So if a GP can do this and get reimbursed, they've almost doubled their charge, which on the one hand sounds like you're just upcharging every patient out there, but on the flip side, so many patients go undiagnosed for sinusitis problems. You could argue that you're getting them treatment earlier or ruling out unnecessary antibiotics and other items that might have additional costs. We've spoken with the ENT specialists, and of course the idea of automating jobs away is a big concern, but if you're a patient, you're looking at several months backlog before you even get an appointment. So it's not like we're stealing customers away from a specialist because they're just lined up. There's so many patients that aren't being treated by the specialist just because there's so few of them out there. So we think this is going to be good for patients and hopefully good for the ENT field as a whole. And we really are looking forward to working with you if you're interested in computer vision or maybe writing some additional grants. One nice thing is we're technically a medical school, so we're publishing papers at a pretty good cadence, and there's lots of sub-projects to work on. We think we have the world's largest database of these images, about 10 years worth, so please contact me if you're interested.